Kyan, can you hear me? I think we're live.
Live, yeah. Ready to go.
Yes. Well, do I begin or do you guys begin? I noticed the script. Maybe I should begin.
Yes, right.
Joseph, and I run a wealth management firm that invests in AI and biotech in Brazil. And I think I'm joined by Paulo from Cydia and Kyan from Outthinker in New York. And we're going to explore what it is to do business in Brazil and AI space and biotech under the current conditions. What I'm involved in and have been involved in since 1998 has been in the cancer and AIDS area of biotech. And I'm interested in what AI and biotech, how they will change given the current conditions. And I think this conversation is about exploring that. I think Kyan's going to take us to the edge of something, and Cydia is located near the Amazon. And I think both things make this a relevant conversation. Kyan, would you like to?
Sure. Yeah. Thank you. Yeah, I thought I would just share a few tips on how to, as Joseph said, kind of think on the edge. That's kind of the background of what I do. I've written 5 books, and my real interest is in how do great innovators and great strategists think differently. And I'm going to argue that there is a science to it. And I'm going to provide 5 tools that will help you think more innovatively about how to do something exciting in the world of business. And it is focused more on health and biotech, but really this applies to anything. My work isn't only within biotech. So I'm going to share my screen and walk you through a brief presentation. All right, so I wanted to talk about this idea of being an outthinker, and if we look at how advances in any domain are patterned, what we see is that people get fixated on a few ways of doing things. For example, in 1968, in the Olympics, something changed in how people went over high bars. Before 1968, everyone went over forward. And then a gentleman named Dick Fosbury decided to turn his back on that tradition, and he went over backward. And what's interesting about this case is that there was no new technology that suddenly made it possible to go over backward in 1968. The technology, if you will, was pads that were put on the other side of the bar that would cushion your fall. Now, those pads were put down already 10, 15 years before he attempted to do this. So the real central question is, why didn't someone do this 4 years before, or 8 years before, or 12 years before? And what I believe is that it's not the technology. See, technology emerges and allows something new to be possible, but it takes us a long time to understand what to do with the technology. And what allows people to now understand and do something different with the technology and seize the possibility that technology represents is the concept. It's not till the concept is introduced. In this case, the concept is the Fosbury flop. Not until we have the term, the language Fosbury flop, can you call up a coach and say, hey, can you teach me the Fosbury flop? Can you get a guidebook on how to do the Fosbury flop? So I'm really interested in not the technologies, but the concepts around the technologies. See, technology changes the rules of the game. And when the rules of the games change, you have a choice on whether you want to keep going over backward or keep going over forward, or you want to go over backward. Let me give you another example, still in the domain of sports. So if we look at the average height of the most valuable players in the NBA, we'll see that in 1960, the last 5 NBA MVPs were about 82 inches tall. And if we follow the trend, we can see clearly every 5 years they're getting taller and taller and taller. And then something strange happens in the next 5 years. Suddenly they're shorter. Is that an anomaly? Well, let's look. Actually, it's not an anomaly. The best players start getting shorter and shorter. And what changed was the rules. The 3-point shot, which basically said if you shoot from further away from the basket, you get 3 points instead of 2, allowed people who adapted to the new rules to learn to shoot from a distance to win and become the most valuable players. Now, we know that the rules are changing. We have augmented reality, we have virtual reality, new customer preferences, we have digital transformation, personalization, tech substitutes, cybersecurity, blockchain, artificial intelligence, data analytics, P2P platforms, and Internet of Things. These are technologies that are impacting biotech, but all industries. And now these trends, which have been underway for already a good 10 years, are now accelerated by the introduction of this new trend, if you will, which is COVID-19. And the question, therefore, for us is, do we want to be a thinker or an outthinker? Do we want to keep doing things the way they have been done, or do we want to do them differently? And so I would encourage you to embrace being an outthinker, which just means understanding and embracing the new concepts around the technology. So I want to just highlight 5 concepts, strategic patterns, if you will, that you can apply to your business idea in order to start moving early, jumping over backward. What you're looking for is something that I call a 4th option. I like to study great thinkers, both business thinkers and social innovators, and they all talk about one concept. My favorite phrasing of what they're talking about is that of Gandhi. He said, first they ignore you, then they laugh at you, then they fight you, and then you win. What he's saying is that we must do something in the market that our competitors, the people who would stop us from doing what we need to do or want to copy what we're doing, instead, what they do is they ignore and laugh at us. And by ignoring and laughing at us, it gives us a chance to grow what we're growing until by the time our innovation takes hold, the other people say, hey, wait a second, that's working. Let's do it too. It's too late. You've already won. Any disruptive business, from Google to Facebook to Tesla to Netflix, what you'll see is that same pattern, is that they look for 4th options. So how do you create 4th options? It's very simple. You apply different concepts than others are applying, and that enables you to naturally think differently. And in my research and my doctorate work, is based off of the idea that there are 36 different strategic concepts or strategic patterns. And what I look at is companies that are, and entrepreneurs that are really thriving in this fast-paced digital world, and ask, what is their playbook? What concepts are they using? What is their Fosbury flop? And I believe that there are 5 emerging concepts that are important for us to embrace today. And if you want to really innovate within biotech or beyond biotech, that we want to apply these concepts. And I want to say, I'm not talking so much about the medical research around the core product or the core solution. What I'm talking about is the business model around that creation. So I just want to give you a few examples of each of these. I encourage you to write down ideas as you're listening. Think of a challenge that you want to take on. And as I give you these patterns, you'll see that you start thinking differently, and ideas will just start popping into your head. 95% of people who go through this process, which we're going to go through in like 6 or 7 minutes, 95% of people say that they think that they may have a 4th option on that list. So that's my invitation to you, to walk out of here with a 4th option. So the first one I call move early to the next battleground. which is basically skate to where the puck is going to be rather than where the puck is, play for tomorrow rather than today. And this is important because cycle times are shrinking. It used to be that an innovation would take 10 years to take hold, but now while you're ramping up one innovation, the next technology, the next way of doing things is already coming. So we need to both play for tomorrow and today. And if we look at great innovators, you'll see that they keep referring to this pattern. I got a chance to interview Elon Musk, the CEO of Tesla and SpaceX and other companies. And I asked him, what made you take the money that you made from selling PayPal and you decided to invest all of that in building rocket ships and launch SpaceX? And he said, I just think a future in which anyone can shoot stuff into space is more exciting than one in which only the government can. And, you know, that sounds like a risky premise to build a business around. So I asked him to explain it to me. And what I came to understand is when he's talking about exciting, what he's talking about is the natural evolution of things, that we're always moving to more exciting states. And the future exciting state for humanity is that we will become an interplanetary species. SpaceX is designed to solve one of the barriers that have been preventing us from living in that future. Very simple thinking. Within pharmaceuticals, there is a gentleman, he is a pharmacist, and he recognized that the experience of people who go to the pharmacy, if they have multiple prescriptions, was very poor. They have to take multiple trips to the drugstore, they have multiple bottles, they get confused. And he said, if we step into the future, the way it should work is you don't leave your home at all. You get the drugs delivered to your home. And they don't come in separate bottles. They're already mixed for you. So if you look on this screen, on the top left quadrant, you'll see top left area, you'll see a little white envelope, a plastic bag, and it has the 3 pills that this person's supposed to take at 8 a.m. on Monday. So he executes this innovation. There's not a lot of technology actually in this. There's no new kind of pharmaceutical innovation. It is the business model. He builds it, and 6 years later, he sells it to Amazon for just under $1 billion. So this kind of thinking can lead you to ideas that can generate $1 billion in revenue, in value in just a few years. So the first thing to ask is, where is the next battleground and what can we do to move there early? The next pattern that's really important is coordinating the uncoordinated. See, we're moving away from a paradigm in which power comes from control to one in which power comes from coordination. Birds fly in flocks. Fish swim in schools, animals travel in herds. They create power and safety by coordinating themselves. And many of the innovations that we admire today are just examples of this concept. Platform business models like Airbnb and Uber don't own the rooms, don't own the cars, they coordinate them. Blockchain is the next iteration of that. In blockchain, you're not only coordinating the ledgers, you're coordinating the nodes that coordinate the ledgers. And we see blockchain already appearing in every industry. Within pharmaceuticals, Chronicled is a blockchain platform supported by these companies. And what they realize is that if they take all of their inventory and supply chain information and they coordinate it all together using blockchain technology, then we can know very quickly if a drug that hurts someone, where it came from, if there are counterfeit drugs in the system. Coordinating nurses, for example, in many countries, it's definitely the United States, there's a nursing shortage. And so a company in Phoenix, Nursio, they created an Uber-like platform called Nursio, which allows nurses to log on and just pick the shifts they want so they can fit in their schedule and create a more flexible contract, if you will, for nurses, bringing more people into the nursing industry. So very powerful to step back and say, who or what would we like to coordinate? The third pattern is to force a two-front battle. And basically it says that successful innovators today, they less often define what they're doing by their industry. They define themselves by something else that allows them to behave differently. Flatiron Health, for example, was created by two ex-Googlers, and one of them had a nephew who got cancer. And in helping his nephew navigate through the ecosystem that he had to navigate, he realized that in the area of oncology, data was stuck in silos, and one doctor would pass off a patient to another doctor, but the information got lost. And he said, let's find a solution for that. And he created Flatiron Health. The mission is to improve lives by learning from the experience of every cancer patient. Now, many people think of this as a software company, but they don't think of themselves as a software company. They think of themselves as a data company. And so what they do is they go to a doctor and they say, use our software. We'll give it to you at half of the price of what you're paying right now for your practice management software. But we would like to analyze your data to give you insights into you did this with this patient and this was the outcome. What's working? What's not working? They go to the next doctor and say, we're not only going to give you the software, but we're going to give you insights from the other doctor so that you can learn from the other doctor. They roll up all of these oncology practices, and they sold this to Roche Pharmaceuticals for over $2 billion 2 years ago. $2 billion in value creation simply by not defining yourself by your industry. So very powerful as you're thinking about what to build, to ask, what business are you really in? And what would that kind of company do differently than others in your industry? The next one's be good. This has been a trend that's been around developing for many years. But basically it says that the old paradigm was that corporations existed to maximize shareholder value, to maximize profits. But increasingly companies realize that if you only focus on profits, you create resistance to your growth. And that a smarter strategy is one that benefits all stakeholders. When your growth is good for your community, for employees, for your patients or clients, for the government, for the country, for the environment, for the world, that is the ultimate strategy, because nobody wants to resist you. And so what we see is many innovations are, especially in health, are driven by a need to do something good. For example, in Africa, a lot of people die because they don't get access to the blood that they need. So they're in a small clinic, they have an injury, they need a blood transfusion, and they can't get the blood quickly enough. So Keenan, he developed a drone, if you will, that can travel long distances. So it looks more like a plane than a helicopter. And they shoot this drone out in order to deliver drugs and drop them right in front of the clinic that needs them very quickly. You don't have to do this as a nonprofit. You can make money also doing good. Best Doctors, for example, it is on a mission to help people avoid negative outcomes of misdiagnoses and help people get second diagnoses. And so what they'll do is, for example, there's a woman that's going blind, and her doctor diagnoses her with brain cancer. She's about to have surgery, but her employer is a Best Doctors customer, which means her employer pays Best Doctors $1 per employee per year, so not very expensive. And she can call Best Doctors, and they have a system to search out the best experts, doctors all over the world. And they found a doctor who says, wait, don't operate on her yet. She may have this rare condition. Why don't you give her these pills first and see what happens? She takes the pills, and now she can see. So they prevented her from having a hole cut in her skull and healthy brain tissue removed. Now they do this profitably. They're growing at 30% a year. They want to be in every country in the world. They're over $1 billion, or they're approaching $1 billion in revenue, but they produce 30 to 40% margin. So the idea is you no longer have to choose between doing good and being profitable. So the question is, how can you create strategic power by doing good? And I'll leave you with one more, which is a very powerful one, which we see successful entrepreneurs, innovators, companies using narrative number 32, which is to create something out of nothing. And what it basically says is that we tend to look at the pieces on the board and try to play with the pieces that are already there. And we miss the opportunity to add new things to the board. Like, you can't, if we're playing chess, take a queen out of your back pocket and put it next to my king. But in Asia, in many countries in Asia, the analog to chess is Go, and in Go, the rules are the opposite. In Go, you cannot move the pieces, you add and remove pieces. So what would happen if you didn't look at what was there, but you looked at adding things or removing things? Tony Fernandez was an accountant in Malaysia, and he bought an airline in 2001 for 27 cents, 1 ringgit, and it was almost bankrupt, but it's now the second largest discount airline in the world. And his whole idea is, let's not focus on airline customers. Let's add new customers to the game, people who don't have access to or can't afford airlines. And that's how he built such a big airline. So a great thing to do is to look at who is not using, right? Who does not have access to clinics? Who does not have access to drugs? Who does not have access to treatments? And then break down what is stopping them from getting access. And usually it's 4 things. Price, they can't afford it. Access, it's not in my town, I have to travel a long distance. Know-how, I have access, I can afford it, but I don't understand how to do it. Or time, it takes too much time for me to access it, and I've got a job and I can't take the time off. So if you can diagnose where someone is not accessing something and break down which of these 4 is stopping them, you can focus your innovation there. Same thing, that is exactly what Muhammad Yunus did. My mother's from Bangladesh, and I've gotten to meet and interview Muhammad Yunus, Nobel Peace Prize winner. He created out of nothing the concept of microfinance, and he recognized that there was a population of people, poor women in Bangladesh, who did not have access to fair loans. And a good friend of mine from college, Brooke Wurst, she was in Africa, and she recognized that there, in Africa, the AIDS epidemic is far beyond the rest of the world. The AIDS prevalence in the world is 1.2%. AIDS prevalence in Africa is 9%. Even though they're only 13% of the population of the world, Africa has the majority of AIDS cases. And one reason is that people don't want to get tested to find out if they have AIDS, because there's a stigma to it. So she went to a village, and she found out they're trying to train young kids to get tested for AIDS early so that they can, take care of themselves. And what she found is, in their language, there was something missing, which is the word for confidential, which is, I'm going to get tested and it's confidential, is the same word as anonymous. So they didn't want to get tested because they were told that you would be tested anonymously, meaning no one would know your name, but they were thinking it's just confidential and someone could find out. So she developed a technology. It's kind of a lot of the technologies were there, but was missing was one piece of technology, which is a fingerprint reader that can parse the information of the fingerprint in small chunks so that it can be transmitted telephonically or wirelessly to be analyzed. And the issue is, in Africa, in certain parts of Africa, the bandwidth is very low. So the current technology wouldn't work. It was just one piece of technology that was missing. And now almost all of the kids who are given this opportunity, 90% of people, test. So what would you like to add to the game? That is the last one. So these are the 5 questions or patterns that I would, I encourage you to think about. Move early to the next battleground, coordinate the uncoordinated, force a 2-front battle, be good, create something out of nothing. And if I want to give you this presentation, as well as I'd like to give you some other tools for free. If you just take your phone and you use this QR code, it'll take you to a Dropbox where this presentation and other tools are available to you for free. So that's what I wanted to share. Thank you.
Paulo, can you hear us?
Sure. Thanks for giving me the chance to. Can you see the presentation?
We can see you.
What about the presentation?
Now we can see we can see both.
Great. So guys, first of all, thanks for the opportunity to be here. I think it's a pleasure. I'm really happy to be here, not just because we are together, but I think that one of the positive aspects of this pandemic moment that we are is that we can put together people and knowledge that maybe we couldn't do in another moment. So it's great to be connected with the audience now and with you two guys during this moment. And also I'd like to thank Claudio for making us a group now and allow us to be here connecting and sharing some experiences. So my name is Paulo Melo. I'm here as a representative of CIDIA. I'll talk a little bit about CIDIA and a bit about the projects that we have been doing now. And I think one of the opportunities we have here is exactly to think, to like brainstorm what we can do together from now on. So just giving a piece of spoiler, I believe that at CIDIA we are not working on biotech so much as we could. So I would be happy to discuss after this with the audience and with you guys about what you can do from now on. So I'd like to thank Keihan for your talk, very inspiring, and I think from now we can definitely work on projects together. So let me start saying about what CIDIA is. So I'm here I'm talking from Brazil. Right now I'm in São Paulo, but I work for CIDIA. CIDIA is based in Manaus, and I will explain for those of you who don't know Manaus yet, where Manaus is located. So about CIDIA, we are an R&D center, so we are private, but we are not profit. So just to give you guys from outside Brazil a sense of this, here in Brazil we have a law that promotes innovation and R&D, research and development activities, and CIDIA is under this law, under this initiative to promote R&D. So we are 15 years old, and some thoughts about where we are. We have an office in Manaus, as I said, and one in São Paulo, where I'm located. And just to, I think most of my talk is about our presence in the rainforest. So just to give you guys a sense of where Manaus is located, we are really in the middle of the rainforest. So we are close to Colombia, we are close to Peru, we are close to Venezuela, and we are in the middle of the forest, which make us very strategic for anything related to biotech, and it's somehow connected to the forest. So just to make this very clear, we are really in the middle of the forest. Although we are in the forest, it doesn't mean that Manaus is a small city. So nowadays we have around 2 million people just in Manaus. It's the biggest city in the state of Amazonas. But just saying that Manaus is a big city like any other Brazilian city. But with this very curious aspect that the fact that we are just next to the forest. So just a little bit about what we do at CIDIA. So now we work with different clients doing R&D, research and development projects. So Samsung is our biggest client nowadays, but we work in health, in telecom, in retail, in many other verticals. And just some numbers about CIDIA. Last year, we run more than 300 projects. We have now more than 900 people just in Manaus. And we have more than 10 labs. So as a R&D center, we focus a lot on research. And to do so, we have all kinds of labs related to UX, for example, user experience, but also related to telecom, to connectivity, and different areas related to technology in general. And nowadays, we work mainly in these three areas. So we work in different fields as well, but just to highlight the ones that we are reinforcing more. So VR and AR, I will give some examples about that. So virtual reality and augmented reality, artificial intelligence and industrial automation. And some cases that I think somehow it may connect with biotech and opportunities that we can evolve after this. So one of the projects is called Animal Trail, sorry. So we have done this project together with Samsung and INPA. INPA is a museum in Manaus, a public museum focused on the animal and the plants, let's say, ecosystem in the region, right, related to the forest. And the idea here was to create a AR, augmented reality application for mobile phone, to bring to the visitors of the museum more information about what they could see in the museum. So to give you an idea, this guy here, he's using the app. So he's pointing the mobile phone to a QR code, and this QR code show him some extra information. For example, this fish. This is a very common fish in the Amazon region called peixe boi. And for any reason, you cannot see, you may not see the fish while you are visiting the museum. So the idea with this app is that you're gonna see a digital example, let's say, of this animal during your visit, just to give you some, experience of what could be the fact that you see the fish. So we are using this app as well to connect the museum to more young audience, so to more young visitors. We see that the digital technology is also a way to connect, to bring a young population to a museum that was not thought to use digital technology. So using AR, we are being very successful in engaging those visitors to the museum as well. So another project we are running right now with Manaus municipality is called Descubra Manaus. So this is not published yet. We are working on it, and it's also a AR application. So the idea here is to bring people to visit certain landmarks in Manaus city, but we also want to collect data. So we want to understand where people are going, where people are visiting. So through this data, we can decide if a certain landmark is not well visited, and then we could do some action to increase that number of visitors, or if you can bring people to new locations that people are not going yet. So the idea somehow is to create data related to tourist activities that nowadays are very poor in terms of data. So there's a lot of discussion about what we can do to bring more tourists, but there's very short number of data about it. So the idea is to work on that and to be more strategic in the decisions about the place we want to give people access to. So just about to close, 1 year ago, we created at CGI Space, we are calling Manaus Tech Hub. So Manaus Tech Hub is also, as the name says, in Manaus. And the idea here is to have an open space for innovation. So it's a physical space. So there is a building in Manaus for this. And the idea is to connect startup, corporates, and government. So in this space, we are right now running an acceleration program with local startups. For now, they are not working on biotech, but some of them are related to health, others to retail, others to education. So it would be great if we could maybe have a public call just focus on biotech, for example, to explore the opportunities in the region. And another thing to add on this is that we are discussing with ONG, a non-governmental organization in Manaus, about using technology, like blockchain, probably, to follow the process of fish production. So Amazon is very famous for fish production. We even export fish for abroad. And the idea is to to have more data about this whole process. Nowadays is very informal. It's really very low data is generated about that, and the idea is to create a platform that support this. So this is going again. This is still under discussion. We are preparing the project plan, but this is something that we want to run in this open innovation hub we have there in Manaus. So that was from my side, and I'm open for questions and discussions.
Thanks, Paulo. How do you see Cydia coping with the current pandemic?
Sure. So about that, what we have done, like in practical terms, what we have done, most of our guys, they went to home office mode. So in terms of work, we didn't feel much problem about the COVID pandemic. Of course, Manaus was actually on the edge of the pandemic, so all the media in Brazil was focusing a lot on Manaus. And one thing that we have done is create an app. So the app in Portuguese is called Info Saúde. So in English would be something like Info Health or something. And what we are doing with that is that we are monitoring people. So using this app, it's a mobile app, we ask all Cydia employees 15 questions about COVID itself. So 15 questions about symptoms, if they do have or not. And if they are okay, they receive a green light. And now we started this week, they can return to the office. So if you say yes for some of the symptoms, you may receive a yellow light. And in that case, you have to talk to the health department in Cydia, and you can get a red light. And in that case, the health department will call you and understand what's going on if you need some support. So what's interesting is that we are using InfoSaúde inside Cydia, and it has been very, very well accepted, and I would say a success. And now we are turning that in a product. So we are offering this as a product by Cydia to clients, to external clients and partners. And we want to make this available for the society. So this is something that we have done. And also, just to connect to something that I said previously, also creates data. So now we can see like how many people and the percentage of that has symptoms or not, and if they are okay to return to the office or not, for example.
Thank you.
You're welcome.
Kaihan, how are things in your line of business since the pandemic started?
Well, certainly there are no large events occurring, and there are no few people want to travel, and so it's forcing. And I think campus parties are great example of that, the events like campus parties serve a purpose. That purpose was traditionally delivered physically with people together. And now we're looking at how do we still serve that purpose, but do it remotely. I think that we're in the area of education and training, facilitation and learning. I'm in public speaking and knowledge leadership, thought leadership. It's forcing everyone to rapidly think about how to change the channel and do things remotely and digitally. And what I think people are finding is that in some ways it's better. I mean, I think it's in some ways it's not better, right? Like anything, there's a pro and con to a change, or in most things. But I think that we're all adapting like really well, and I think that we're not going to go back to needing large scale events like this. That from now on we're going to see some blend of people in person and people virtually. It's changing how people connect with each other, right? Like, we don't have to have just Portugal or just Brazil, right? We can have Portugal and Brazil participating together. And that's true across all geographies. And as we get better at collaborating across digital channels, I think it could really accelerate innovation in the world. That's my hope.
Yes, Paulo, you have mostly a real estate model at Cydia, isn't it?
Yes, that's true.
How is that impacted? How has that been impacted for you?
Sure. Yeah, I was talking about this with Kehan yesterday. So the funny thing is that after the pandemic, or during the pandemic, we realized that we could work from home. So we were not really discussing that so much like we did during the pandemic. And now we are discussing a policy, an internal policy to have home office. So basically, this has a lot to do with the Brazilian law, the labor law. So right now we have, as I said, most people working from home. So the fact that we did, let's say, a good job working from home also allow us to consider home office as an option. So still, we have a lot of work that has to be done presentially, because, for example, we work with some devices that they are not commercial yet, so prototypes and even end products, but they are not released in the market yet. So in that case, you have to be in a specific room with some kind of security about that, and that's something that you have to be in the office. But in the end, it's hard to say again, especially because I'm in Brazil. I work for a company that's based in Manaus. But what I'm trying to say is that the pandemic was really good for some aspects, and one of those is exactly related to the way of work. So we understood that we can work from home. About big events, 2 weeks ago, we participated in an event in the gaming industry. We have a gaming studio in Manaus, and basically this event is for the gaming industry, and our participation was virtual, so it was through a tool like the one we are using right now, and it worked so well. So indeed, it's really powerful. We talk to people, like in Poland, in Russia, in Brazil, anywhere in the world, and through a tool like the one we are using right now. So it's really opening possibilities that we didn't invest so much time like we're doing right now.
Thank you. And if you were attracting a new company to Cydia in the biotech space, what would be the value proposition, or even just some of the perks of coming all the way to the Amazon, for instance, being nearer to the Amazon?
Yeah. So one of the things that we say a lot during the prospections meetings that we have is the fact that the fact that we are in Amazon is really special. Like, it doesn't matter if you are in biotech field or not, but Manaus is really far away from the big cities in Brazil, but also really well, let's say, protected in a way. So you cannot arrive in Manaus by a car. You have to take an airplane or a ship. So somehow you have to go there through air or through water. There's no roads connecting the rest of Brazil to Manaus. So that makes Manaus not only interesting from the biotech aspect, but also for being a very isolated, in a way, very controlled zone. So you can easily test some products and services that we want in a very specific population. So just to give an example, we are now discussing a project in health. The idea is to collect data related to health. And one of the reasons to run this lab, the idea is to create a health lab. And the idea to create this lab in Manaus is exactly because of the special, let's say, profile of the population there. So there are many, let's say, positive aspects of being in the middle of the forest, not only in the forest aspect, but also relate to the population, the local population. So there are many people from outside Brazil outside Manaus coming to Manaus, but also the Indians in Manaus makes the mix of the population there very, very unique.
Yeah, we've had, my company works with a few of the universities and technological centers here in the Northeast.
Mm-hmm.
Everything you're saying sounds great, but we've experienced a lot of delays because of COVID. A lot of the labs have been overwhelmed by just simple things like testing for COVID-19, for instance, right? We can't access our level 3 security labs, not mention level 4, right?
Mm-hmm.
So it's really great and refreshing to hear that you're very optimistic and positive about how CEDIA can still operate. We're basically limited to this medium at the moment, and very we've kept busy because that's sort of our nature, like to keep working, keep doing something, try to advance. That's sort of like how we go. But really, this pandemic has really created situations that we didn't have to deal with before. So in addition to having, the challenges of biotech and AI coming together, and like those being way out, like on the edge of something, and having to deal with, most people not getting it, or what the hell are you talking about, kind of a thing, right?
Mm-hmm.
Now we're dealing with, oh, now how do we do this from home? Well, you can't have a level 3 lab at home,
Yeah, exactly.
So, and I'm assuming most of the pharmaceuticals are having similar issues at their own buildings. We have a different business model where we work by cooperating with governments and universities and different institutions. And I was interesting listening to Kaihan, how we actually do one of those steps where we sort of like put everybody together, sort of like take that install capacity and bring something from it, like create a business around that. And that's what we've been doing from the very beginning, whether it was Cuba or Brazil or wherever we acted. We discovered that there was this enormous untapped install capacity at universities and other centers around the world that just wasn't being used. Some of them were limited by IP agreements. You'd have to share your IP with the university or whatever it is. But we found a way of creating a model that worked for us and them. And now all of a sudden that has been impacted by this in a way that it occurs like we just have to wait or design new ways of moving forward. So I'd like to hear from Kaihan in closing, like, what do you see when you hear somebody like me, that's a business owner and an investor and really willing to be out on the skinny branches, seeing that, it's become difficult for us, at least as right?
Yeah, I think what I see across many different industries is this idea of IP is changing and allowing for greater collaboration. I think that's part due to technology and in part due to mindset. That there are there are technologies and some of those technologies are used in blockchain. So it's not blockchain, but the blockchain is a combination of existing technologies. But there are ways of sharing information or validating that information exists without revealing the information, right? And so it allows for people to collaborate on that, opens up platforms. I was speaking to the chief strategy officer of Alibaba, and they really built the business around the idea of it being a platform that allows people to collaborate. And they've been working on that for 10 years, is how do we encourage people to collaborate in a safe way. And then, so that's the kind of the technology solution. But then there's also this idea of, one of my favorite books is by a professor at Harvard Business School named Bharat Anand. And he wrote a book called The Content Trap. And what it's about is that the content trap is the idea that you have to hold the IP in order to create value from it. You have to own the movie. You have to own the music, and that's starting to shift as well. So I'm really curious to learn more. Maybe not here, but what was the model that unlocked that collaboration that you were able to unlock? What I've seen is it's a combination of technology and mindset.
Thank you. Guys, I think that's it.
Great. Let me just, Joseph, let me just to close saying that actually during the pandemic, CDIA not only kept the projects that we are running, but actually we are increasing. So nowadays we have 150 open positions in Manaus. So just to say that we understood that we can work well during the pandemic as well. So hopefully we have a good message to live here, and CJ is going well. Thanks God.
Excellent.
Excellent. That's great.
Thanks, guys.
Thank you.
Thank you. Bye bye.
Bye bye.
Pleasure.